Childhood obesity is a continuously growing problem in the United States. The main reason is because children are becoming less active and enjoy sugary foods and drinks. Research shows nearly 18% of children and teens are obese, and since 1980, the numbers have tripled. This epidemic and bad habits for children must stop soon. Most of the obesity in children starts in the household. It is argued that parents may seem like they support obesity because they feed their children anything they want just to make them happy. I'm not saying that all the blame is on the parents. However, teaching kids about healthy habits is a part of their responsibility too, since they are not always at home. A study from York University published in the journal Obesity Research and Clinical Practice looked at daily diets and exercise data and found that it's getting harder for kids and teens to actually stick to it. However, even with this, you must realize the harmful effect of childhood obesity. Obese children have a higher risk of getting high blood pressure, high cholesterol, heart disease, type 2 diabetes, and breathing problems. They are also more likely to become obese adults. There was recently a case study of the youngest person ever to be diagnosed with type 2 diabetes, a 3-year-old from Europe. It's unknown to most Americans that globally the number of overweight children under 5 is over 42 million. In my opinion, I would try to educate parents to help bring these numbers down. These children are far too young to be having aches and pains in the hip, knees, and ankles just because of lack of diet and exercise. It is the fact that children who are overweight will have a higher chance of encountering complications if they were to break a bone. Their surgery recovery times could also be longer and more challenging. Lastly, it's unfortunate, but they also have a higher chance of premature death and disability in adulthood. Childhood obesity has been well publicized for the past few years from Michelle Obama's Let's Move program. The effort to decrease overweight children and impact their lives continues to gain momentum. It all started when Ms. Obama gave a keynote address and stated, "We can't lie around on the couch eating french fries and candy bars and expect our kids to eat carrots and run around the block." Parents have an impact on what their child eats and does. Parents can provide healthy fruits and vegetables to their child and limit their fatty food consumptions. You can also be physically active with your child as well. Take them to the park or have a family walk with them. Showing kids that being physically active is healthy for you. There are also things that could be done outside of the home, in the schools, that can help children in their weight trouble. We could start supporting healthy school nutrition plans so kids can have healthy choices to eat for lunch. If the school can't change their meal plan, pack a healthy meal for your child yourself. Develop more physical programs before, during, and after school. You can put in more physical education classes or have the children be able to go outside more than one time in their 8-hour school day. Also, make free water available throughout the school, limiting the sale of sugary drinks that are in the vending machines. Better yet, you can take the sugary drinks out of the machines, limiting their choice to healthy beverages as in water. Parents and schools both need to work together for a healthier child. However, the media also needs to think about what they put on television with their products they put in their cartoons and on popular television shows. Children are prone to follow what they see on television, and so if a child sees their favorite character unhealthy thing or unhealthy habits, the kids are more likely to do the same. In saying, kids are more likely to ask for food they see on their favorite program. Let's work to reduce the statistics that 1 in 3 kids in the United States are obese, and another third is overweight. Let's work together to make our kids healthier and more active. Show them that eating good things, as in vegetables and fruits, is better for you than eating junk food. Parents should set the example for your children. What you eat, they should eat as well. Schools should get the children involved in more physical education programs and take the sugary drinks out of the vending machines. A healthy and physically active child is what we are striving for.